Why does hemoglobin S impair oxygen transport in sickle cell? Imagine your red blood cells as tiny delivery trucks carrying oxygen from your lungs to every part of your body. In healthy people, these trucks are round, flexible, and can easily squeeze through tiny blood vessels. But in sickle cell disease, a small change in the truck's design causes big problems. This change involves a mutation in the hemoglobin molecule, specifically producing what is called hemoglobin S. This mutation causes the hemoglobin to behave differently when it releases oxygen. Normally, hemoglobin binds oxygen easily and releases it when needed. But hemoglobin S tends to stick together when it loses oxygen, forming long, rigid fibers inside the red blood cells. These fibers distort the shape of the cells into a sickle or crescent shape, making them less flexible and more likely to get stuck in small blood vessels. When these sickled cells block blood flow, oxygen delivery to tissues drops, causing pain and tissue damage. The mutation in hemoglobin S changes how oxygen binds to the red blood cells. Hemoglobin S has a lower affinity for oxygen compared to normal hemoglobin. This means it needs a higher amount of oxygen to become fully saturated. As a result, oxygen is less efficiently picked up in the lungs and released in tissues. When the red blood cells deoxygenate, the hemoglobin S molecules start to stick together and from those fibers, which makes the cells sickle-shaped. This process is not instant. There is a delay before the fibers form, which allows some red blood cells to pass through capillaries before sickling occurs. But once sickling happens, the cells become stiff and sticky, blocking small blood vessels and reducing blood flow. This blockage prevents oxygen from reaching tissues, leading to episodes of pain called sickle cell crises and tissue damage. In addition to blocking blood flow, sickled cells are destroyed more quickly than normal cells, leading to a shortage of red blood cells, a condition called anemia. With fewer healthy red blood cells available, the overall capacity to carry oxygen decreases even further. The polymerized hemoglobin S inside the sickled cells also has a very low affinity for oxygen, which means it does not hold onto oxygen well once it is bound. This disrupts the normal cycle of oxygen pickup and releases, making oxygen transport even less efficient. Understanding this process shows why treatments that help prevent hemoglobin S from polymerizing or increase its oxygen affinity can be helpful. For example, certain medications aim to reduce sickling or improve oxygen delivery, but they must be carefully balanced to ensure tissues still get enough oxygen. Always remember, if you or someone you know has sickle cell disease, consulting healthcare professionals is essential for personalized care. The science behind hemoglobin S explains why sickle cell disease causes symptoms like pain, fatigue, and organ damage, and why ongoing research continues to seek better ways to manage this complex condition.